Our trust was created in September 2011. We originally brought together 3 groups of NHS staff. From April 2012, we were delighted to have transferred across to us another 1,000 staff from adult social care in the County Council. And together that has made us one of the biggest integrated partnership trusts in the country.
Well, one of the main priorities for the County Council is enabling people to be as independent as possible and take as much control of their life as possible. And we felt that bringing health and social care together for those people who are frail and elderly in particular was an excellent way in which we could deliver on that outcome. But we also wanted a service that was better value for money.
Our trust covers a huge geographical area. Today I happen to be in Leek. Within 15 miles in one direction from Leek we can have some of the most rural communities with real challenges about how they access health services. And yet travelling back towards the city in the north, some of the most challenging health inequalities.
You hear nationally, and we go to conferences where people are talking about, why don't we integrate? Isn't that a good idea? Well, Staffordshire is one of the few places that's done it. It's also done the biggest integration across the country in terms of bringing together over £150 million of local authority resources and double that in terms of health resources.
I'm really pleased that we've been able to bring 4 cultures together, to start to bring together an organisation with a clear identity, someone that talks actively with local patients, local commissioners in general practice and within the local authority.
When I was diagnosed, I only used to have tingling hands, nothing else was affected, just my hands. And I had it for years. I had my daughter Lauren, she's 2.5. And while I was pregnant with child, I had chronic sickness every day. And I had my major relapse in January, where it just completely knocked me off my feet. It was just my right side completely gone. I was struggling just to do basic things, like dress myself. And I was pretty much then wheelchair bound. It just suddenly just went, and I couldn't, all of a sudden, I couldn't get up the stairs. It was at breaking point really. So that's when we made the referral.
A referral came into the team indicating that the family were at crisis point due to Helen's relapse of her MS. I came out to visit and found Helen was no longer able to walk. She'd lost the use in her hands. So I discussed what services they felt they needed.
It was obviously one person I could speak to, having that single point of access, and she sorted out everything for me, my physio, obviously doctors coming in, so it was fantastic because I just had one person to talk to.
What we looked at was putting in an enablement package of care at home to provide support for Helen with her personal care, and also to look at regaining independence with her physical abilities.
I can get upstairs now, I sleep back in my own bed, I can have a bath in our normal bathroom, and I can do a lot more. Obviously I was wheelchair bound and now I'm on my crutches walking around, so I do know eventually, you know, fingers crossed, I'll be back to normal life again, looking after my children.
When you spend time with local people, often their frustrations about different practitioners, different professionals from different agencies coming into their home in a way which doesn't feel very coordinated for them. And our concept of providing someone to manage that care is exactly what they've been asking me to do.
Behind me we have the single point of access area, and there is a health and a social person. They sit on there, taking referrals directly from GPs, from area social workers, from district nurses, from patients themselves, and we'll deal with that patient's referral at source.
Hi, it's Lynn from Stafford Community Intervention Team.
We're actually, within the next month, having a trial. All members of staff will have a DigiPen, some will have a sat-nav, but all will actually have either a tablet, a netbook or a laptop. And we're out there going to be working with patients to trial this, and the response that we get back from these patients are that, you know, to have a service that provides everything for them, to them, it's so different It's so forward thinking, and the fact that, you know, their problems are dealt with directly and not pushed onto somebody else.
Patients have talked about this for some time, and I think the thing they say is that the services don't always seem joined up to them. They don't know what's going to happen next. If they have a bit of a problem with their care, they don't know who it is that they actually talk to. I think when you're not feeling very well, you don't want things to be complex and difficult. You've got enough worries, and I think we need to make sure that pathways for patients are very straightforward and simple.
Across Staffordshire, the population is an increasingly old one. The dependencies of local people are becoming more and more significant. And we're able to care for people now in their own homes, but with greater dependency. So many conditions that would have seen people entering into sort of residential care are now supported in their own home.
Well, Dad was sort of semi-independent in his flat here, which is a sort of annex to my flat. He had a fall in early February, which involved, well, he damaged his kidneys basically, and he was in hospital for 3 weeks.
On discharge from hospital, he was still very poorly, very, very dependent. His health wasn't particularly robust.
The enablement team came in when Dad first came out of hospital and helped with his personal care, and it was a huge learning curve for me, and I sort of worked alongside them as much as I could.
The fact that they were there to give me assistance and tell me directions in which to go, I didn't have much confidence. That was the main thing, confidence.
What we're here for is to help Vic to improve, to reach his potential, to regain skills.
So we've had help as well from occupational therapists and physiotherapists. And as the weeks went on, that progressed further and further with more and more demanding exercises, to the point now where after 12 weeks of the programme, he's actually able to walk again now, which is something which he I know he wouldn't have done without the support that he's had from the enablement programme.
And push. I think if we hadn't have been able to have the flexibility and the multidisciplinary approach that we would have had, Vic would have ended up possibly in permanent care, I feel.
We'll see a much more personalised service where people have actually got control over the services that come into their homes and that they purchase. So we would expect to see more and more people with personal budgets for them to purchase their own care. And one of the things we're starting to see in terms of the numbers are more and more people who have a brief intervention from the trust and then no longer need their services for a while because those services have worked and made the difference they need to make.
One of the ways we want to bring about this little bit of a revolution in care in our patch is about setting up integrated care teams where community nurses, social care, general practice, mental health workers all work together in the patch and support people in their home.
We've got a really blossoming relationship with other local services, with education, with younger people, with police and fire services. And it's the first stage for us in bringing together public services to provide care and support for people in a much more coordinated way.
That transformation around integration is the priority. And I've seen the plans, and actually some of those plans are already happening. So I'm very positive about a new service evolving.
What we want for patients is exactly the same. It's amazing, there's complete uniformity, and you sometimes don't know what the background of the person you're talking to, because although there may appear to be barriers, when it comes to what's best for the patient, we all agree. And that is an amazing thing.
Looking forward, one of the opportunities we see from Foundation Trust status is to engage more broadly with both the community at large and many of our partners and staff in how the organisation takes the delivery of care forward in the future.